This is the sixth presentation in GIT series, prepared by Professor Sharaf and revised by Professor Hani Sami. This is the appearance of fundal varices, where varices appear as tubular filling defects at the affected region. On the left, the fundus is involved, and on the right, again, the fundus is involved by large, smooth outline filling defects appearing as if polypoid lesions at the fundal region. And here these are the fundal varices, tubular-like structures. This is an appearance of a large mass with a fleck of barium, and we said before that a fleck of barium denotes ulcer. And here we have the antrum and canal, pyloric canal, and this is the cap, and there is a polyp here, as this is called a small adenoma or a small sessile polyp at the region of the antrum. Of course, such things need biopsy, but a large smooth mass at one side of the stomach or the esophagus with an ulcer along its surface is characteristic of a large myoma. Here we have a lot of things delineated with barium, here and there, and this one, that one, here, there, again here, and this is the cap, and this is the pyloric antrum, and this is the pyloric canal, and this where what we call incisura angularis is there, and incisura angularis or peristaltic wave, and this is the fundus, and this is the body with multiple gastric polypoid lesions. Gastric inflammatory polyp, here is the cap, and then the loop. This is the pyloric antrum, and this is the pyloric canal. We have a polyp here, this proved to be gastric inflammatory polyp. Gastric non-distensibility, remember the spelling of plastica, so we can put pancreatic tumor, lymphoma, amyloid disease, sarcoid disease, and syphilis, tuberculosis, ingested corrosives, and carcinoma. But for simplicity, the most common are four: carcinoma, lymphoma, gastritis, and scoring. Gastroma, lymphoma, gastritis, and scoring. This is this limited distensibility of the stomach due to creeping Lionitis plastica from carcinoma. Another case where the whole region of the pylorus is involved and pyloric antrum while the cap is spared. Again, the limited distensibility is due to large infiltrating cancer. Note the abnormal osteoblastic appearance of the spine. Again, another case of Lionitis plastica. Here it is due to metastasis, as there is metastasis in the liver and the stomach as well. So we have deposits in submucosal and we have deposits in the liver, and here we get Lionitis plastica involved in the body and pylorus. This is the region of the antrum, and here we find an annular filling effect appear as if there is annular compression by fist of the hand. This is due to mass, gastric carcinoma. A fundal carcinoma can appear as soft tissue shadow against the air within the fundal gas bubble, and this is the thickness of the subdiaphragmatic region, which is increased with irregularity and shouldering at the esophagogastric junction. Of course, here we have long segment of narrowing at the pyloric antrum is due to pyloric antral carcinoma. It gives an appearance similar to Linitis elastica but limited to the region of the pylorus. Gastric neoplasm again with definite narrowing of the region of the pylorus. Gastric lymphoma, we have the large masses into the lumen and outside the lumen, outside the confinement of the lumen, here and there, denoting exophytic components. So we have exophytic components here and here and this area. These are the characteristics of lymphomatous or lymphosarcomatous infiltration of the stomach. Gastric lymphoma, again with large exogastric mass, large extragastric mass, and limited sensibility of the region of the body. Here the whole stomach is involved as coarse gastric rouge with irregularity and ulcer formation. So we have ulcer, we have irregularity, nodular appearance, and we have long segment of involvement of the stomach, mainly by nodular and irregular mucosal elevations with ulceration. This is lymphoma. Typical appearance of GIST: the large exophytic and the small endophytic, leiomyosarcoma, small endophytic, large exophytic, leiomyosarcoma, exophytic and endophytic, and this is the region of the stomach, leiomyosarcoma. Stromal tumors, again, large exophytic mass, soft tissue shadow of large exophytic mass, and small endophytic portion involving the region of the body of the stomach. Leiomyoblastoma, large mass confined to the stomach and narrowing its lumen. Linitis plastica can also be reduced due to the presence of Kaposi sarcoma in AIDS, where we get also enlarged lymph nodes at the retrogastric region. This is a pancreatic carcinoma invading into the stomach, an example of how extension can occur. Ovarian carcinoma with polypoid metastasis of the liver. This is the appearance of the polypoid metastasis in the liver, and this is the appearance of the ovarian carcinoma. This is how melanoma deposits can occur, giving what we call target sign in the stomach itself. So we have secondaries, we have primaries, and within the primaries we have carcinoma and we have lymphoma and the other GIST, stromal tumors, and we have the secondary from the pelvis and secondary from direct extension from the pancreas, and so on. Thank you.